Hello everyone, welcome back to episode 60 of the EMDR Doctor Podcast. This week I'm talking about crying in EMDR sessions, answering a lot of questions that I get asked quite frequently. In fact, almost everyone who is having their first EMDR session, I tend to kind of preempt this question and let people know that yes, EMDR does really bring out the emotion in the subject, and it's quite okay to cry as much as you like while you're doing EMDR. Of course, it's quite okay to cry as much as you like anytime, but especially while you're reprocessing really difficult memories. So people often say to me that they thought that they had cried all the tears that they needed to cry on that particular memory, but they're really surprised to find that there is still another layer, another level of emotion there once we start to process the memory that we're working on during EMDR. And there's often a little bit of underlying sadness just still hanging around, and this can really speak to how memory can still really affect us even when we think it's completely resolved. We can distance ourselves from the memory, we can intellectualize it, hide it away, put it away in our memory cupboard and think that it's out of sight, out of mind. But when we take it out and put it under the EMDR microscope, we find that there is often a lot of sadness and a lot of tears still lingering there. So how does EMDR get to the heart of these memories? Well, like most questions in psychology, nobody really knows, but there are a few theories. So maybe it's just the allowing, maybe it's the focusing on the memories, kind of mindfulness aspect of it. Maybe the bilateral keeps us going from the left brain to the right brain and back again to the right brain. Maybe it's some other completely unknown mechanism. So it's really important to know that crying during EMDR is not a sign of anything getting worse. The crying is the release of that powerful emotion, and it's generally a sign that the memory is being accessed really well, really thoroughly. And if we continue to work through it, and we continue with the bilateral stimulation, then it gets processed. And what does that actually mean? So that means that the emotion actually gets released or freed or separated from the memory, and then it's let go from the memory. The memory loses the emotion, and that becomes more factual, just matter of fact, more everyday, more acceptable, more just something that happened. And why doesn't this process happen just normally when we cry? A lot of people tell me that they have cried buckets over a particular memory and it still doesn't resolve. Well, this is where the bilateral stimulation comes in. The eye movements or the tapping, and also the specific setup of the memory, the belief, the emotion, the body, and it's all recognized together within a session of EMDR. And sometimes in a session we come across a little bit of a block. Someone might really want to cry, to let it all out, but they just can't. And this may be because when they grew up in their family, there may have been a real aversion to crying. Maybe parents would say something like, and you might have heard this before, "Stop that crying or I'll give you something to cry about." A lot of people have heard that before, very sadly, because this is really shaming and it's threatening and it's punitive, and a child only needs to hear that once and they get the picture. Crying is not acceptable. Bad things happen if you cry. Only babies cry, grown-ups don't cry, all these unhelpful messages or learnings. So quite often in a session, I'll see someone getting a little bit teary, and then suddenly it's like a wall just comes down. They just clam up and shut it down. They get sort of stony-faced and everything just gets internalized again. So what happens when I do that is to help people cry a bit. I've got these lovely big soft cushions in my room, and I'll offer the cushion and suggest that if they want to have a big cry, they can just bury their head in the cushion and have a big sob without the pressure of me being able to see their face. And while they're doing that, they might be holding on to the buzzies still, so having a big cry into the cushion with those buzzies in their hands, or with their permission, I might tap on their shoulders or sometimes tap on their knees. And what that does is it keeps the bilateral stimulation going while they're having a big cry, so they can have their emotional release without the pressure of me looking at them, and they can still keep going with the processing. And they feel quite supported and also private and validated, and they're allowed to release in a way that is safe and therapeutic. Because having a big cry during EMDR therapy is a really fast way to heal, and it's a really fast way to allow that emotion to resolve. The temporary discomfort leads to a lasting release and relief and emotional freedom, and it allows you then to remember without reliving. And I tell people that the tears that they cry during an EMDR session, they don't need to cry again. They are done. That particular bit of sadness is released, is done, is gone. Now I have a little warning here. So this doesn't mean if there's a lot of crying during an EMDR session and those particular tears are cried, that doesn't mean that all the crying is done. Sometimes after a big cry in an EMDR session, someone will tell me that they went home and they cried more, and they cried on and off for a couple of days. So often I'll let people know that that might be something to expect. That in a sense, the sadness of that particular memory that we reprocessed during that session is actually related to a broader memory network with all these other discrete memories that are kind of tied in with that particular memory. So a memory network is like a group of memories that all belong to the same theme. So for example, maybe every time your father gave you the strap, they might be all related to the same theme. They might all of those times be in a memory network. And we might choose one particularly bad one to work on from that memory network. So we might choose a particularly bad example. Maybe it was the first time that happened. Maybe it was the time that happened in front of a friend, or a particular memory that stands out for some reason. Maybe the strap that time caused bleeding that hadn't happened before. So something that kind of made that memory worse. So we'll pick the worst one or the biggest one, sometimes the first one, sometimes the last one that people can remember. Because the last one of a set of a memory network might be significant for some particular reason. So we choose one memory from that memory network that kind of resembles all of the other memories or represents all of the other memories in that network. And if we resolve that particular memory, over the next couple of days, there might be some crying or some sadness expressed about all of the other memories in that memory network. All of the other less prominent memories will come forward, and that will be what causes the sadness. So here I want to say that if there are a lot of memories in that memory network, we don't have to work on every single one of them. If we work on a couple of standout memories that kind of best represent that memory network, that whole network will be resolved. So we don't have to do an EMDR session for every single time your father gave you the strap or whatever the memory network represents. So we just have to do the key ones, and then that whole memory network does resolve. So if you find yourself crying after an EMDR session, it does not mean that that EMDR session hasn't worked. It just means that your brain is continuing on doing more processing and more releasing of more of those memories in that memory network. It's good work that you're doing when you're crying. So crying is helpful. Crying is a release. Crying helps to resolve those memories and release those memories. So if you are crying after an EMDR session, feel free to use some bilateral while you're crying. So what does that mean? That means that you might be face down on the bed and also tapping your shoulders. It might mean that you are in the shower having a big old cry and also looking at 2 points in the bathroom, letting your eyes go between those 2 points and crying. And in that way, you are doing a little bit of self-EMDR that's going to help that processing go a little bit quicker. But if things are difficult for you, then do feel free to contact your EMDR therapist. Most EMDR therapists are very, very willing to have a short chat in between sessions, or even schedule an emergency session and not wait for the next week to go by until your next session. So sometimes just having a little chat to your therapist just can validate what's going on for you and just give you the knowledge and the strength to keep going in your process. So now I just want to touch briefly on a problem that I come across sometimes with new clients with EMDR. So sometimes someone will come in and say, I don't have any trauma, I just feel sad. I feel low, depressed, I can't shake it, I feel sad all the time, I just can't seem to feel happy. Will EMDR still work for me? And generally speaking, the answer is yes. So if we dig a little bit into that sadness, that just pervasive feeling of feeling low, then often we will find trauma. And it might not be obvious, it might be attachment trauma. It might be micro trauma, or what we might call small t trauma. So these are not big events, they're just little events that happened maybe many, many times when you were little. So this might be that you grew up with a parent who was depressed themselves and never had the energy to help you feel happy or help you enjoy your young years or feel safe enough to feel free and liberated and joyful. So it might happen if people were parentified, or if they grew up in a family with alcoholic parents, or maybe the parents were just absent and there was a lot of other caregivers in the family that weren't very close. Maybe there were religious themes of sadness or suffering or scarcity and shame. So shame can be really implicated in sadness, and shame can be quite kind of subliminal, very hard to detect. It's hard to feel shame and worthlessness at the same time as being happy. So all of these things are very treatable with EMDR. All that micro trauma or small t trauma can have a really big impact, and they're all treatable and they're all reversible. So just like we can learn as a baby or a child, maybe we learned to believe that we were worthless, we can certainly, as an adult, believe that we are worthy and that we are lovable and that we are good enough and that we have the right to feel happy. And then that sadness can just ebb away. So I hope that's been helpful. I look forward to talking to you again next week. In the meantime, take good care. Bye for now.